David is 32 years old, and he was diagnosed with MS 5 years prior in our center. David initially presented with optic neuritis and was started on a high-dose interferon beta. He had no further attacks until approximately 6 months ago, when I saw him for an acute transverse myelitis. This improved after steroid therapy. I'm seeing him today for residual gait imbalance and leg stiffness. Good to see you, David. Let's see how you're doing since I last saw you. It looks like your leg weakness and numbness resolved after steroid therapy, but you mentioned that you're having problems with walking and imbalance. Can you tell me more about this?
Well, it's really just my left leg. My leg muscle feels like it gets tight and then relaxes. Sometimes it's painful. Then when I try to walk, it feels stiff, sort of heavy. It's difficult to move. When I actually start walking, it feels like my left leg wants to move outwards. It just affects the way that I walk sometimes, and I feel off balance.
Can you tell me more about the muscle tightness episodes? For instance, how frequently do you experience this?
I'd say it happens about once every hour, especially when I'm sitting down or resting.
How does this affect your sleep?
I haven't noticed anything, but my girlfriend says that my leg moves a bit when I first go to sleep, but that it stops and doesn't occur in the middle of the night.
And your leg is stiff when you first try to stand up?
Yes, but it goes away when I start walking.
What about pain in any other areas, such as your back?
It's really only my left leg. I haven't had any back pain.
Are you experiencing any problems with bladder or bowel function?
No, I'm not.
That's good. Sometimes bladder and bowel problems can aggravate the symptoms that you're describing. You're still working at the insurance company, right?
Yes.
So how do these changes affect your quality of life and day-to-day activities, such as getting yourself ready and getting to work?
There isn't much impact on my daily routine. I can drive to work and get around when I'm there. I'm mostly just bothered by the increasing muscle stiffness and interference with walking. I guess I need to come to terms with the fact that MS will affect my walking, and that people will now be able to see that my walking is different. I look at some of the MS discussion groups online, and I've been hearing about a number of treatments. Will any of these help my symptoms?
You're correct. There are treatments for the symptoms. I'd like to observe your walking, and then I'll do an examination to look at your reflexes, muscle tone, and strength. Then we'll talk about some exercises and medications that can manage your symptoms. We definitely want for you to remain as active as possible. You haven't been going to physical therapy, have you?
No, but anything we can do to improve my symptoms would help me a lot.